digital assessment. Here is my student ID. My friend is recording. She will do a 360 of the room. Okay, I'm gonna do my hygiene. And my gloves. I'm gonna clean my stethoscope, both the bell and the diaphragm. Hi, my name is Benedictor. I'm a student nurse and I'm in the University of Bed.
William Overton, 1932.
Okay. Hi, William. Today I'll be doing a head digital assessment. Is that okay with you?
Yes.
Are you in any pain or discomfort? You want to use the washroom? And now I'm going to provide practice. So looking at the physical appearance, the patient has no body odor and color matches the genetic background. Can you stand? Okay, sit. Okay, so patient height. The body structure, patient height matches the stated age. The patient has good nutrition. There is no physical deformity, and patient is symmetrical. Okay, looking at the facial the behavior, the facial expression matches the situation. Patient has a clear speech. Patient has good personal hygiene, and patient is able to maintain good eye contact, and also patient is dressed in accordance with the weather. Okay, looking at the work of breathing, the work of breathing is effortless, it is noiseless, it is unlabored, and there is no signs of respiratory distress. Looking at the level of consciousness, can you tell me your name?
William Overton,
Do you know where you are?
hospital,
Can you tell me the time of the day?
afternoon,
Okay, so patient is alert, not asleep, and aware, and 3 times oriented to person, place, and time. Okay, now I'm gonna inspect the facial features. So the facial features are symmetrical. There's no lesion, there's no scars. Color matches genetic background, and there is no involuntary movement. Okay, I'm gonna perform cranial nerve 7, which is the facial nerve. Can you raise your eyebrow? Can you close your eyes with resistance while I try to open? Can you puff your cheeks while I try to deflate them? Okay, can you smile? Can you show your teeth? Can you frown? Okay, so patient cranial nerve 7 are symmetrical and they are intact. Okay, now I'm gonna inspect the eyes. So the eyebrows are symmetrical. There is hair distribution and the eyelashes are even. There is no ptosis or lid lag on the eyebrow. The sclera is white with thin black vessels. Can you look up? Okay. The conjunctiva is also pink with red blood vessels. Okay, now I'm gonna do oculomotor, which is cranial nerve 3. So first, I'm gonna measure the pupils. Okay, so the pupils are 4 millimeters. They are round and round. I'm gonna test for consensual and direct light. Okay, so direct, consensual, direct, consensual. So pupils are reactive to light. Now I'm gonna test for accommodate. Can you look at the pen? Okay, so pupils dilate to a far vision and they convert and constrict to a near vision, indicated on the accommodate. So they are accommodate. Okay, indicating cranial nerve 3, the oculomotor is intact. Okay, now I'm gonna inspect the ears. The ears are symmetrical, color matches genetic background, and there is no discharge, and the cerumen is yellow in color. So the nose is also midline, and there is no discharge. I'm gonna inspect the lips. The lips are pink. They are pink and moist. They are symmetrical, and there is no lesion. I'm gonna test for cranial nerve 9 and 10, the glossopharyngeal and the vagus nerve. I'm gonna press this against your tongue, and I want you to say ah for me. Open wide. Okay, so the uvula and the soft palate rises evenly when patient says ah, indicating cranial nerve 9 and 10 are intact. So now I'm gonna perform cranial nerve 12, which is the hypoglossal nerve. Can you stick your tongue out? Okay, so the tongue is midline. Can you move it side to side? Patient is able to move it side to side. Can you say light, tight dynamite?
Light, tight, dynamite.
Okay, so patient is able to say light, tight dynamite with no tremors, indicating cranial nerve 12, the hypoglossal nerve, is intact. So now I'm gonna inspect and palpate the neck. So for inspection, the neck is erect and midline. Color matches genetic background. There is no scars, there is no lesion. And now I'm gonna palpate. Let me know if you feel any pain or tenderness. Any pain?
No.
Okay. Check in for the trachea position. Okay, so there is no pain or tenderness. Temperature is warm to touch, and the trachea is midline, and there is no obvious enlargement of the thyroid. Okay, now I'm gonna palpate the carotid artery, one at a time for 30 seconds. Move to the other side. For 30 seconds too. Okay, so it is 2 plus strong, it is regular, and it is equal bilateral on each side. Okay, now I'm gonna perform the spinal accessory nerve, which is cranial nerve 11. I want you to look where my hand is, where I apply resistance. Look on this side. I apply resistance. I want you to shrunk your shoulder while I shrunk your shoulder. I apply resistance. Okay, so cranial nerve 11 is also intact. Okay, now I'm gonna inspect the upper extremities, and I will cover the lower extremities when inspecting the upper extremities. So I want you to stretch your hands for me. Okay, so for inspection, they are symmetrical on each side. There is no joint deformity, color matches genetic background. There is no scars, there is no lesion, and hair distribution are evenly. Okay, now I'm gonna palpate. Let me know if you feel any pain. Any pain?
No.
Okay, checking for temperature. So there is no pain or tenderness. The skin is dry. There is no joint inflammation, and there is no edema or masses, and there is no any palpable masses. Okay. Now I'm gonna do the radial pulse. I want you to, your hands straight for me. I'm gonna perform the radial pulse bilaterally for 30 seconds. Okay. It is 62 beats per minute. It is 2 plus strong, and it's regular and equal bilaterally. Okay, now I'm gonna do the hand grip. I want you to grip my hand really tight. equal bilaterally too. Okay, now I'm gonna inspect the lower extremities, and by then I will cover the upper extremities. Can you stretch your legs out for me? Okay, so the legs are symmetrical, her distribution are equal, there is no scars, there is no lesion, and color matches genetic background. I'm gonna palpate for any pain or tenderness. So please let me know if you feel any pain or tenderness. Any pain? I'm gonna check for temperature. Any? No. Okay. So for temperature is 1 to touch. There is no edema. There is no joint inflammation, and there is no temperature is 1 to touch. There is no joint inflammation. Joint temperature is also 1 to touch, and there is no pain or tenderness or masses, superficial mass when palpated. Okay, now I'm gonna the patient to turn around. Okay. Move to the side. I want you to move your head to the side. Okay. Thank you. So inspection of the posterior thorax, the color matches genetic background. There is no scars or lesion, and there is no skeletal deformity. The spinal process is also made live, and there is no abnormal pulsation around. Okay, now I'm gonna palpate. Please let me know if you feel any pain. Any pain? Any pain? Okay, checking for temperature. Okay, so there is no pain or tenderness, there is no masses, and there is no masses. There is no pain or tenderness. There is no masses. Temperature is 1 to touch, and there is no edema on the. And I'm gonna check for chest expansion. Sorry. Breathing. Okay, chest expansion is also symmetrical. Okay, now I'm gonna auscultate. Okay, when I say breathe in and out, then you breathe in and out for me, okay? Breathe in and out. 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 In and out, in and out, in and out. Okay, so upon auscultating, there was no crackling or wheezing. I couldn't hear no adventitious sound. The vestibular and the bronchiovestibular sounds were also heard. Yeah, so now I'm gonna assess the anterior thorax. Let's turn around. Okay, so I'm going to assess anterior for 30 seconds. Okay, so the breaths are 16 breaths per minute. It is effortless, it is unlabored, and it's noiseless and regular. Okay, now I'm gonna landmark the apical pulse. So the apical pulse is on the mid-clavicle on the left, sternal border, on the fifth intercostal space, and the valve there is called the mitral valve. Okay, I'm gonna auscultate the apical pulse for 30 seconds. So it is 64 beats per minute. It is 2 plus strong and it's regular. Okay, now I'll move you to the bed for me. Sorry. I'm gonna drape appropriately, just exposing the abdominal area. Okay, so for inspection, the abdomen is round. There is no masses, color matches genetic background. There is no lesion and there is no scars. And the umbilicus is midline. So I'm gonna auscultate before palpating to avoid any fake paresthesia. So for auscultating, I'll start from the right lower quadrant. The right upper quadrant, the left upper quadrant, and the left lower quadrant. Okay, so there was growling, indicating the stomach is in hyperactive stage, and the frequency was 5 to 30 bowel sounds per minute. Okay, now I'm gonna palpate. Please let me know if you feel any pain. And I'm gonna use the same sequence that I used with auscultating. So palpating. Any pain?
No.
Any pain?
No.
Any pain?
No.
Any pain?
No.
So there is no masses, no pain or tenderness, and there is no rigidity. So now I am done. I'm gonna call the doctor to come in and check you. Thank you. And I'm gonna cover you up for the doctor. Thank you.
Done?